but from other parts of the world, things may be different. So today we have a very special webinar by a very special person, Dr. Aeen Mohammadi. He is one of the pioneers of e-learning programs in Iran. And I know him for many years, I mean, particularly when we started SIVU International Virtual University since those days. He and Rita, his wife, Rita Mustazadeh, they have contributed immensely to the program of SIVU International Virtual University, not only in terms of conducting and facilitating the webinars, also outlining, planning, and executing the various activities that we have done. So we are grateful to Aeen Mohammadi and Rita. Rita is away at the moment. She's busy with a conference with the president, I'm told, with the president of the university. So allow me to introduce Aeen Mohammadi. Dr. Aeen Mohammadi is MD, MPH, PhD, and he is in the Department of E-Learning and Medical Education, the School of Medicine, Tehran University of Medical Sciences, Tehran, Iran. Of course, you know that e-learning took up very, very strongly during the COVID era and has continued to multiply, though we were just talking a moment ago that probably it's static at the moment. However, I feel that the blended learning will continue to prosper and e-learning is here to stay. So we learn a great deal about e-learning in various modalities. But I'd like to mention here that Aeen has especially, he's developed this program along with his wife and colleagues in the form of MOOCs as well for Iran. It's called Arman. It has, sadly, it's not been applied so far, but I'm hoping that one day SIVU will benefit with their expertise and benefits. So today is going to talk about assessment theories, how to assess objective test data. Now, this is one of the most difficult subjects that I've encountered in medical education. I remember when we started medical education, when I started learning about medical education in 1979, we used to go to Shiraz to learn it. Shiraz was a center, WHO Center for Medical Education. From then onwards, since then, I'm always scared. I must confess openly, I'm always scared of assessment program. I've enjoyed curriculum development. I've enjoyed the teaching strategies. Assessment is a very, very specialized field. Now, the learning objectives that he's highlighted in the flyer are many, but I'd like to mention that he's going to talk about reliability and validity. Two are the most important factors that we always discuss and learn about in assessment and evaluation. He's going to talk about the classical test theory. And one of the most important things to me is the item response theory. I know it because my sister, when she did PhD from Calgary many years ago in medical education, this was the thesis that she written on. So with those words, allow me to welcome Dr. Aeen Mohammadi from Tehran University, Iran. Welcome, sir. The forum is open for you. Thank you.
Thank you, Professor. Thank you. Hello, everybody. I thank all of you for scheduling and participating in this webinar. And I would like to thank my Professor Zaidi, and all colleagues at SIVU for holding these webinars. I'm going to have some discussion briefly about different assessment theories. As Professor Zaidi told, at the first, I will have some topics about basic post-examination results, and then I will have brief discussion about main assessment schools, assessment theories, classical test theory or classical item analysis, generalizability theory analysis or G theory, and IRT and rash modeling. All right, before beginning the webinar, I would like to apologize for any inconvenience during the webinar, because these topics, as the professor said, is approximately complicated and hard, but I have tried to make it simple and applicable for all medical teachers to use this webinar in their daily assessments, inshallah. Okay, you know that one of the most important parts of an examination is preparing and providing feedback to students. In formative assessments, we prepare output of assessment for students as a valuable feedback, and in summative ones, we use it for formal judgments on knowledge and performance of students. So it is too important to interpret the examination output as I told, we have three different theory for this interpretation: classical test theory, G theory, and IRT. Okay, when we hold an exam, at the first step, we would like to have some descriptive analysis about it. First, we try to draw the distribution frequency for each item, for each question. This diagram help us to know about missing questions. If we have no missing questions, it's maybe due to guessing by students for some questions, or we can result that our students have good knowledge. And if we have some missing question responses, it's maybe due to inadequate time for completing the examination, or our exam had been too hard, or it's maybe because of the negative score in our exam. Okay. After this diagram, we would like to analyze each individual item. Before that, I should remember some basic statistical points about dichotomous or binary distributions. You know, objective tests such as MCQ have a dichotomous distribution. That is, the answer would be 0 or 1. The mean of these distributions is the proportion of students who answered correctly, denoted as P. And in this distributions, variance is equal to fraction correct P crossed with Q, fraction incorrect. For example, in an exam, we have 300 students answered question, for example, 1 correctly, and 100 students answered it incorrectly. So the P, or mean, is 0.75. 3/4 of students have answered the question 1 correctly. And the variance is 0.18. Okay, what these numbers show us? This item maybe is too easy because the difficulty of the question is high, 0.75, and it shows that 3/4 of the students have answered it correctly. On the other hand, the responses to item is not too dispersed. It has a little variability, a little standard deviation, and most students paid attention to the correct response. If the question have a high variability with the mean at the center of distribution, this question may be useful. Please remember that if we have a little standard deviation or little dispersion in individual scores of an exam, this score would be too hard or too easy. Okay, it was a simple item analysis for each question. After obtaining the mean and standard deviation for each question, traditionally we calculate total performance of each student by summing the correct responses of to each question. This total performance will be used to calculate the mean and standard deviation of total performance for further analysis. This is the distribution of total performance of an example exam. You see that it is positively skewed, and in this case, the mean is greater than median and mode. So we can result that most students have a low to moderate mark, and a few students receive a relatively high mark at the tail on the right of the distribution. But in this distribution, we have negative skewness. And in this distribution, the mean is less than median and mode. So most students have moderate to high mark, and a few students receive a relatively low mark at the tail in the left of the distribution. And finally, as you know, this is a normal distribution. In this case, mean, mode, and median are the same, and half of the students scored greater than the mean and half of them less than the mean. Okay, on the other hand, we can use variance and standard deviation for interpreting, simple interpreting of total performance. You see the examination A at the left is more dispersed compared with examination B. We can conclude that examination A at the left is more heterogeneous than examination B, and examination B is more homogeneous than examination A. Okay, so this was a simple item analysis interpretation of outputs of an objective exam such as MCQ. But at this point, I would like to discuss about more interpretation of results of an exam using classical item analysis or CTT. Okay, I would like to ask you to remember the concept reliability. As you know, the reliability is the ability of the test to measure a student's knowledge and competencies consistency. For example, if students are re-examined with the same items and with the same conditions on different occasions, the results should be approximately the same. The most important concept in CTT or classical item analysis is reliability. In classical item analysis, the observed scores is equal to true score plus a score derived from errors. So variance of observed score is equal to variance of true score plus variance of errors. We define reliability as the ratio of variance of true scores to the variance of observed score. If we substitute the variance of true score with the variance of observed score minus variance errors, we can result that reliability finally is equal to 1 minus variance error scores on the whole divided by variance of observed score. This equation shows us that if we have no random error, the reliability would be 1 or 100%. And when the variance of errors, the sources of measurement errors increases, the reliability estimates will decrease. In classical item analysis, we calculate reliability with statistical procedures. In fact, if we want to calculate true score in classical item analysis, we should repeat the exam infinite time, and it is practically impossible. So we use statistical procedures such as Cronbach alpha, and Code-Richardson 20. Cronbach alpha would be used for a questionnaire with a continuum choices, for example, Likert type questionnaires, and Code-Richardson 20 will be used for dichotomous questions such as MCQ. In classical item analysis, if the reliability was less than 0.7 or less than 70%, the exam constructor should revise the items and maybe remove some questions with low item total correlations. Let's have an example about using reliability in CTT to improve the quality of our exam. This is an example of a 4-item exam that you see at the table 1, the reliability derived from the test Cronbach alpha of the exam is 0.72. At the table 2, you see the scale mean if each item deleted, and at the right column, the Cronbach alpha or reliability of the exam of if each item deleted. If we remove the items number 1, 2, or 3, the mean scale or Cronbach alpha will change little, very small. But when we remove the question number 4, the mean scale increase and the Cronbach alpha would increase to 0.9. At the table 3, you see the reliability Cronbach alpha of this new 3-item exam, which is 0.95. And at the table 4, you see that if we remove any of questions 1, 2, or 3, we will have very small changes in the mean and reliability. This is one application of reliability for removing the items with low item total correlation that would result to a higher quality exam. Okay, please note that Cronbach alpha, Code-Richardson 20, and other statistical procedures for calculating reliability in classical test theories conflate all sources of measurement error in one value. I told you that reliability is variances of true variances of true scores plus variances of error scores. So all of the sources of measurements errors would be calculated in one value. If we would like to partitionate these sources of measurement errors into its factors, we should use generalizability theory or G theory that I will discuss in later slides. Other indices in classical test theory are item difficulty index, item discrimination index, point by serial coefficient that in fact is a kind of discrimination index, And factor analysis, both explanatory factor analysis and confirmatory factor analysis are other indices in classical item analysis that because of shortage of time, I ignored them. Okay, as you see, in classical test theory, we have some limitations. The most important limitation in this theory is that we cannot identify potential sources of measurement error. CTT, such as any other statistical procedures, have some prerequisites. Assumptions and prerequisites of CTT are not always met. In this theory, all items are supposed to have the same value. For example, you have a 20-item question. All questions from 1 to 20 have the same value for us. And in classical test theory, one examiner's test results is dependent to other examiners. For example, for calculating difficulty index, we calculate the proportion of the students who have answered the question correctly. So the difficulty index of each question for one student, it depends on other students. And as I told in classical test theory, if you want to calculate the real true score, we should repeat the test infinite time. It is practically impossible, and we are persuaded to use statistical procedures. Okay, before starting the next session, if there is any question, please write down at the chat box. I will read and discuss about it. If you have no question, please enter a number 5 in the chat box. It ensures me that all of you have virtually presence in the webinar. Thank you very much. Okay, let's have some discussion about generalizability theory, or G theory. As you know, the reliability is the ability of a test to measure a student's knowledge and competencies consistently. And traditionally, we are used to use classical test theory to calculate this reliability. But I told you that in classical test theory, we cannot partitionate different factors that causes measurement errors. In an exam, we have some different factors that may cause errors. For example, items, examiners, conditions, students' attributes and characteristics such as sex, age, and other individual characteristics may be the causes of measurement errors. In classical test theory, reliability estimates cannot identify these potential sources of measurement error, which each of the measurement error is called a facet of the test in G theory. In G theory, we try to recognize and estimate these facets and finally manipulates them to decrease the errors and improve the quality of exam. G theory is actually an extension of CTT, and using G theory, we can have a clearer picture of sources of error for interpreting the test output. Okay, each facet or each sources of measurements error has a variance component. Traditionally, we use the test analysis of variances or ANOVA to calculate this variance components. This variance components finally will be used to calculate G coefficient. G coefficient is in fact the equivalent of reliability in CTT, and using G coefficients we will be able to generalize the student average score over all facets. G2 analysis can provide useful information and help us, as I told, to minimize and identify sources of errors. Let's have an example about G theory. Imagine that we have held an OSCE, objective structured clinical examination, with SPs, standard patients, a range of examiners, for example, 3 examiners and various items to assess students' performance on 12 stations. In this case, we may have some sources of errors or facets, for example, standard patients, examiners, items, and interaction between each facet and objects of measurement, for example, between SPs and students, between SPs and items, and so on. At the diagram below the slide, at the bottom of the slide, you can see the difference between CTT and G theory. At the left, you see that all of the sources of errors will be calculated as one value called random error. But at the right, you see the result of G theory. The G theory help us to partitionate it to its components and measure the components variances. After defining variance components of each facet, we will calculate G coefficient. That, as I told, G coefficient is just like reliability in classical test theory. So we have two kinds of ANOVA procedures. If we focus only in one facet, only in one source of measurements, it would be single facet design, ANOVA. And if we focus on more than one facet, it would be multiple facet design, ANOVA. First, let's have some discussion about single facet design. For example, in our OSCE exam, we would like to examine only a single source of measurement error, for example, examiners. I would ask you to remember that single facet design, G coefficients is equal to reliability derived by tests such as Cronbach's alpha and Coder-Richardson 20 in CTT. In our OSCE, I told we would like to focus on the influence of examiners. So we name this model one-facet model, or students crossed with examiner design. Imagine we have 3 examiners independently rate 10 students on 3 stations using a 1 to 5 checklist of 5 items. So the total mark would be 5 to 25. For calculating G theory, we firstly enter the data of the exam into the SPSS. At the left, you see simple data entry spreadsheets in SPSS. We have 10 students and 3 columns for marks of the 3 examiners, examiner 1, examiner 2, and examiner 3. First, we restructure data. We can restructure data with SPSS. At the right, you see the restructured spreadsheet. For each student and each examiner, we have 1 mark. So the results will have 30 rows from 1 to 30. Student 1, examiner 1, score 14. Student 1, examiner 2, score 22, and so on. Then we will use ANOVA to calculate variance components. For this procedure, we click on the tab Analyze, and then the folder General Linear Model, and then we will click on variance components. In the equation, we put ASCII score, total ASCII score as a dependence variable, students and examiner as random factors. I should remember that, as I told in G-theory, in this example, students are objects of measurement. So we ignore the variance derived from students. The table below the slide shows the results of this ANOVA test. Source of variations are students, examiners, and students multiplied by examiner. At the middle column, you see variance components, 10, 1, and 13 approximately. And at the right, you see the percentage variances. 40% is derived from students, 6.2% from examiners, and 53% derived from interaction of students and examiners. As I told, because students are objects of measurements, we ignore the variance derived from students and interaction between students and examiners, and we focus on the variance components of examiner alone. Okay, now we can calculate G coefficient. We show G coefficient as rho 2. Student variance components, sigma 2, residual variance, sigma 2 residual, and number of examiners are K that is equal to 3. I remember that residual variance is variances not attributed to any known factors, but derived from interaction of different facets with objects of measurement. You know the equation that the result is equal to 0.7. And it shows that our exam have a reasonable and acceptable reliability, in fact. Okay, let's extend our example on ASCII exam for a multifaceted design. Imagine in our ASCII examination, we have examiners, stations, SPs, and items, and as I told you, each of these facets may be a source of error. Okay, doing the same procedures in SPSS would result this table at this slide. You see the source of variance, students, examiner, item, SP, station, students crossed by item, student crossed with examiner, student crossed with item, and examiner and item, interaction with examiner and station. Please note that the variance components of SP, standard patients, and stations are equal to 0. So these factors are not a source of error. And item since the students are the objective of measurements in our example, we will derived from students or interaction of item examiners and item multiplied by examiners with the students. At the last row, you see the interaction between item, examiner, and station, that is 0.007. It is approximately equal to 0, so we ignore these two. Okay, this is the equation of G coefficient, and you see the ratio of variance of students to the variance of the students plus variance of each factor divided by its number. And it's equal to 0.92. And it would be a very high and acceptable G coefficient. Okay, Dr. Mona has asked, how did you calculate the residual variance? I told you the residual variance is derived from interaction of each facet with the object of measurement. And in this case, you see the sum of all students crossed by item and so on are residual variances. Okay, in this example, I told G coefficient is high and various components of the facets are low. So we can result that our ASCII is very good. Otherwise, we should redesign our ASCII exam. For example, we should train better our examiners or modify number of stations or revise our items and so on. This manipulation of the different aspects of an exam using G coefficient is called as D study or decision study. D study enables assessors to define sources of error, improve the quality of assessment with evidence-based criteria. Okay. I hope it has been easy. Okay, is there any question?
Not at the moment, but I have a couple of questions from previous sessions, which I have noted down that I'll ask you later.
Thank you. Thank you. Okay.
Thank you.
Okay, let's continue the presentation. And at this point, I would like to have some discussion about IRT, the most complicated part of the presentation. You know, test constructors, teachers have traditionally quantified the reliability of exam tests using CTT model, and we usually use different item analyses such as difficulty index, discrimination index, reliability coefficients derived from Cronbach's alpha and or Coder-Richardson 20, factor analysis, and so on. The aim of IRT or item response theory is measuring the relationship between students' ability and item difficulty to improve the quality of question. And this IRT helps teachers to choose questions appropriate with the ability of given students. And we can use it to build up better question banks. I would remember that item difficulty in IRT differs from difficulty index in classical test theory. I will discuss it later. Imagine we have hold an anatomy exam. When the student's anatomy ability increases or items difficulty level decreases, it would result to increasing the probability that a student can answer a given item correctly. IRT attempt to analyze this relationship between the student test scores and other parameters, such as item difficulty, item discrimination, guessing the answer, and so on. As you know, the probability of a specific response, which is 0 or 1, is related to two group of parameters. The first parameters are person parameters, which we say student ability denoted with theta. And the second groups are item parameters. Item difficulty denoted by B, item discrimination denoted by A, and pseudo-guessing denoted by C. So we can result that we have different kinds of IRT. When we focus only on item difficulty and student ability. For example, we want to assess the relationship between these two item analyze, the item difficulty and student's ability alone. We would have one parameter logistic IRT that is famous as RASH model. But if we will focus on further parameters, for example, discrimination or guessing, we would have two parameter IRT or 3-parameter IRT. Okay, at this point, I discussed about 1-parameter logistic IRT. 2 and 3 parameter are too difficult to realize, and we usually use the software, specific specialized software for calculating 2 and 3 parameter IRT, such as Winstead and so on. In 1-parameter logistic IRT or RASH model, we calculate the scores of students' ability and values of item difficulty. And at the next step, we standardize them. You know, when we standardize a distribution, the mean of this distribution is set to 0, and the standard deviation is set to 1. For calculating students' ability level, we use this equation. Theta 2 is equal to natural logarithm of correct fraction divided by incorrect fraction. And for difficulty level, it would be calculated with this equation, natural logarithm of a ratio of incorrect fraction to correct fraction. Okay, when we standardize two distribution, it will help us to compare these two distributions. In this case, if theta minus b is equal to 0, we can conclude that the ability of the student and item difficulty is approximately equal. If theta minus b is greater than 0, we can result that the ability of a student is more than item difficulty. So the item would be easy. And if theta minus b is less than 0, the ability of the students is less than item difficulty, and we may result that the question is hard. Okay, let's have an example for RASH modeling. This is a 7-item exam done by 7 students. At the bottom row, you can see fraction correct for each item, and at the last column, you can see fraction correct for each student. we can calculate with previously told equations the item difficulty and student's ability, B and theta. When, for example, the ability of students 2 is 0.9 or 0.89, this is above the mean standard. And when the value of item difficulty is minus 1.73, it suggests us that the item is relatively easy. Okay, now we can calculate the probability that a student with a specific ability will answer a question with a specific item difficulty correctly. This is the equation of Rash. P is the probability that the given students answer a specific item correctly. Theta is the student's ability, and P is item difficulty. In this exam, the student's number 1 answers item 1 with the probability of 0.12. We can result that if the level of student's ability and the level of item difficulty are matched or are the same, approximately the same, our probability to answer correctly is 15%. The table in this slide shows the probability of answering correct the question number 1 with the different 7 students. The second column shows us item difficulty minus 1.73. Theta is each student's ability, and P is probability to answer correctly. Okay, one of the most important aspects of IRT is item characteristic curves, or ICC. I only have a small discussion about this curve. You know, normal distribution, if we calculate the area under the curve with integral and draw the cumulative frequency, we will result in normal ogive that you can see at the right of the slide. We use this normal ogive as item characteristic curve in IRT and Rash modeling. In this curve, we put the student's ability at the bottom at the x-axis and the probability of answering correct at the y-axis. And you can see the relationship between item difficulty and the student's ability in this curve. This is a complete curve derived in 3 parameters model of IRT. You know, the dotted line shows the student's ability, B, and the probability to answering the item, which is theta. The slope of our curve show us the discrimination curve slope and the distance between the beginning point of the curve with the 0 point at the y-axis shows us the amount of chance. For example, in this curve, the intercept of curve with y-axis is at the point 0.1. This shows us that the students have 10% chance to answer the item correctly. Okay, let's come back to Rash modeling. There are 3 curve, curves here in rash modeling. What do you think about these curves? As you see, the point of beginning is 0, so we have no chance. And the slope of the curves are the same, so we are not focused on discrimination index. The only parameter that changes is the student's ability. When the curve shifts to the right, we can resolve that the item is hard. And when the curve shifts to the left, we can resolve that the item is more easy. And at the right is the curve at the middle, and this is a good at optimum item. Okay, what about these two curves? As you see, ignoring the chance parameter, approximately the B of two curves are the same, but the value of the slope differs in two curves, and the value of the slope at the right is greater than the curve at the left. So we can result that the discrimination power of this item is more than the one at the left. Discrimination between good and weak students. Okay, would you please write your opinion about these three curves? What say us the curves green, red, and black? Each one shows us a harder item. Okay, as you see, in these three curves, we have please note, you're right, but vice versa. Then I said that when the curve shifts to the left, it shows that we have more ability to be able to answer the question correct. So the black one shows us a harder one, and green shows us the easiest one, and the red one is at the middle of the two others. And all three curves have the same value of slope and have no chance. Thank you. Okay. Thank you for your answer. Okay, what about these two curves? You see, ignoring the chance in blue one, you see that the B or ability of the two curves are the same, but we have different slope. And the red one has the value of slope greater than the blue one. So we can result that the red one have discrimination level greater than the blue one. And finally, these three curves show us the difference between rash model and 2 parameters and 3 parameters model. Please note 2 dotted curves. At the left, we have rash model. The C, chance, and the slope are constants, and only the B or ability would change. At the middle, we have 2 parameters, logistic IRT model. The chance is the same, but the ability and the slope of curves that shows the discrimination varies. And at the left, we have 3 parameters logistic IRT model that chance, ability, and discrimination, all of them have included into the care. Okay. I hope that I have presented a useful topic, and you can use these theories in your daily and routine assessments. This is my main reference for this presentation, and I would like to remember my teacher, Professor Human, who is famous as the father of Iran psychometrics. We missed him some years ago, and whenever I worked with IRT, I remember him. And these are three famous scientists. At the left, Charles Spearman, who gifted us a classical test theory. He's the founder of London School. And at the middle, Lee Cronbach, who gifted us G theory. And at the right, George Rasch from Denmark, a Danish scientist who gifted us IRT and Rasch modeling. I highly appreciate your attention. Thank you.
Well, what a marvelous talk, a lecture beyond all kinds of accolades. Superb by a master teacher. Now, I think Professor Mona has a question. Mona, would you like to unmute yourself and ask a question?
Yes, thank you very much, Professor
Go ahead. Go ahead.
For giving me the chance to talk to you. I enjoyed this marvelous presentation. I must say you did a wonderful job, although it was really, really very difficult for me to grasp some parts. But I wanted to ask you, sir, about two things. First of all, you mentioned pseudo guessing. What is, I can't understand the difference between true guessing and pseudo guessing. Pseudo means false, right? So what is pseudo guessing? Thank you.
Yes, pseudo guessing is a term that have been used by Dr. Rasch. It means the chance. For example, in a four choice in MCQ, we have 25% chance to answer correctly by chance. In five choices, we have 20%, and so on. It's equal to chance.
So, Mona, you have one more question?
Yes, please. Actually, I'm not very good at statistics, so I just wanted to ask you, sir, about Cronbach alpha. How do you calculate it?
Okay.
Thank you.
Cronbach's alpha is the correlation between each item and total scores. In fact, in Cronbach's alpha, we calculate total correlation between items, and it has a simple equation, but I prefer to calculate Cronbach's alpha with SPSS. You should enter data of each question into SPSS, and then in the folder SK and reliability. You may choose alpha, and it automatically calculates Cronbach's alpha or put a Richardson 20.
Thank you. There are lots of accolades in the chat box, and of course, you're worthy of all those and much more. Now, I have three questions that I must ask you. I've been waiting to ask an expert. Every time I attend a session on assessment and evaluation, I feel like a stupid fool trying to learn the ABC. But here is a master who can teach me. So you talk about all these various factors in the traditional methods of assessment. Are there any innovative assessment tools that have come up in the recent digital technology? That's the first question.
Okay, traditionally we use classical test theory. In most countries, classical test theory is predominant for interpreting exam output and for interpreting the results of objective exams. But in North Europe, and after inventing software, specialized software, the IRT have been spread very high in different countries. For example, in TOEFL and other English languages, they usually and routinely use IRT to point the ability of learners exactly. They provide a question with a specific difficulty, and if the students answer it, they would increase the difficulty, and so on until the learner can't answer, and then vice versa. Lower the difficulty index, so they can point exactly the ability level of students.
Thank you. There's a lot to learn. Now, in the last webinar, that was last year on assessment and evaluation, I don't remember who conducted it, but there was a question raised by one of my favorite colleagues from Kufa University. He's not here today. And I think that's a question which is rather relevant. He asked that question that what are the reflective tools, or should I say, how's the reflective thinking and feedback process incorporated in the assessment? Feedback and reflective thinking.
Feedback, you say?
Yes, thank you.
Thank you. Yes, I told feedback is very important in medical education, in education as a whole. Feedback, we provide feedback for two persons, students and teachers. IRT usually used for feedback for teachers to improve their exam and their questions. Using G-theory and IRT, exam constructors can exclude and remove low quality questions and questions with negative discrimination index, not questions with are not appropriate with the ability of given students, and so on. And for students, we can compare them with their classmates. For example, we can say them the point of weakness, point of powerful in knowledge and competency, and so on. But feedback on teachers and the students differs. The IRT and G-theory is mostly used for preparing feedback for teachers.
Thank you so much. I will, I'm sure he'll be able to listen to your talk in the recorded videos on the LMS of SIVU. Habib is a great scholar from Kufa University. I'm sure he'll be delighted to hear. Now, my final question is, before we conclude the session, is relevant to my topic, which is medical ethics. So what are the ethical considerations in assessment in medical education?
Okay, it's a very hard question and good question. Thank you. You know, after inventing IRT, after delivering the RASH model by Professor Rash, it is said that the reliability concept is dead. And ethically, we cannot use reliability concepts used in classical test theory in our routine assessments. But unfortunately, because of complication of IRT, because it is too hard to calculate, because the softwares using for calculating the IRT, the outputs are too expensive and not accessible, usually we use classical test theory. In fact, if we be able to use IRT results instead of classical test theory, I think it would be more compatible with ethical aspects of assessment.
Yes, I think ethics is a very delicate subject, and that's a pity because in the triangle of education, you have knowledge and skills on either side, but nobody talks about ethics. Very few people talk about ethics, which is the fulcrum on which you base knowledge and skills, because without moral values, knowledge and skills can go haywire, create difficulties. It's been a marvelous talk. We've thoroughly enjoyed. I have thoroughly learned and enjoyed a great